Hello, this is Dr. Sunil Roy from Excellence Medical in Donnybrook. So today we are doing a surgical excision of a very large lipoma on the back of the left shoulder. So we have prepped the large lipoma. We have cleaned it with some bethadine solution, marked it with a surgical marker. So I've given local anesthetic around the large lipoma, and usually I let the local anesthetic work in a good way over 5 minutes or so. So I have made an incision, and I have exposed the lipoma, and I'm cauterizing the blood vessels. I'm injecting more local anesthetic into the lipoma area for two reasons. One is that the patient would feel less discomfort, but also the adrenaline in the local anesthetic would vasoconstrict the area, resulting in less bleeding. This particular lipoma is quite fibrous, something called fibrolipoma, which means that it's quite adherent to the tissues, may it be the skin and the underlying tissues. So it mostly has to be cut out. Gradually, step by step, I'm freeing up the lipoma of the adhesions, and I usually try to remove it in one piece if possible. Uh, so yes, just the fibrous nature of this lipoma requires it to be gently dissected all over. Small bleeders on the way are cauterized to minimize the bleeding and the blood loss. So lipomas can be capsulated lipomas, in which case they are easier to remove because you can enucleate them through their capsule. Others don't have a capsule, and they may have a fibrous component to them, which means that they have to be gently dissected and excised out, usually in large pieces as such. removing some of the pieces by gentle blunt dissection. Again, just cauterizing the small bleeders along the way. We are gradually getting there, so we are ready to remove the bulk of it. So as you see, this lipoma is unusually adherent to all the structures, including the skin and the underlying fascia. So we are patiently, gradually dissecting and removing it. I'm just packing it to put pressure on small bleeders, and usually that ooze stops. At the same time, focusing on small areas at a time. Leader inside that's not visible on the camera. So I'm trying to pack it with a swab while continuing to remove the lipoma in other areas. This is a deep bleeder that I'm cauterizing. In the end, I'm having a look and removing any remainder small pieces of the lipoma. The rest is just fibrous tissue. So we have removed the lipoma fully. The specimen will send for a biopsy just to make sure that there's nothing that needs any further treatment. So now I'm getting ready to close it in layers. So when you remove a large lipoma like this, there is a filling gap in the tissues. So this is closed in layers to assist with adequate healing. I'm using a dissolvable stitch which will dissolve over time inside. This is the second layer of our closure. So proper closure not only ensures that tissues heal in an optimum satisfactory way, but it also prevents any collection of blood or water inside the cavity called a seroma. So, with such a large lipoma, which is referred to as being a giant lipoma, it gradually stretches the skin and the other tissues in a way that when you remove it, the skin is quite lax in the area. So, when it's repaired in a good way, gradually in the healing process, those tissues shrink and contract over time. Typically takes around 9 months to a year, but the end result usually is quite good. So we are closing the deeper layer of the skin. The wound is fully closed now, but since it's in a joint area and adjacent to a joint area, the movements etc. can put strain on the wound. I'm just putting some sutures on the outside as well to reinforce the internal stitches. This also gives a better aesthetic appearance to the scar. Following the procedure, the patient was discharged and seen back in around 12 days. So at review, the wound had healed satisfactorily. So I removed the stitches. The patient was very happy with the outcome of the surgery.